We don't want reflux to go on and on unmanaged because the stomach contents, they're acidic, they can be very aggravating to your esophageal lining. And there are issues that can come out if it's going on for a long time. Plus, it's super, super uncomfortable and it's just very disconcerting and it can be really impactful on your quality of life.
Welcome to the Bariatric Nutrition Coach Podcast, where we empower you with weight loss surgery, nutrition knowledge, mindset advice, and inspiration so you succeed in your weight and health journey. I'm your host, Jane Stoltz, and I am a bariatric dietitian who has helped over 1,300 people on their weight loss surgery journeys. I'm also a solo mum, lover of long walks while listening to podcasts, partial to a glass of wine, and the ocean is my happy place. Join me as I dive deep into bariatric nutrition and lifestyle topics and deliver them to you in bite-sized, palatable episodes every Monday. Now let's go.
Welcome to my podcast. If you've never listened to my podcast before, welcome. I'm so glad you're here. If you're one of my regular listeners, again, thank you so much for listening to my podcast. So the topic has come out of a listener question, and I've got a couple of other listener questions that I will cover in future podcasts on the different topics that they've submitted. So thank you so much. If you have a topic, a question that you would like me to talk about that is bariatric nutrition related, please send it through. If you look in the show notes of my podcast, you will see the link, Ask Jane. You just need to pop your first name in and the question or the topic, and I will cover it in one of my podcasts. So thank you so much. Before we get into the podcast today, the topic, and get into all things reflux, I'll give a shout out to Alex from Instagram, Bariatric Bear 1988. Thank you so much, Alex, for sharing my podcast in your socials. This is a long time coming, Alex, because you did this some time ago, but I wrote it down because I can't remember things. Now I'm going through menopause. Even before that, I would not have remembered things from that far back, but I really wanted to give you a shout out, Alex, and say thank you so much for sharing my podcast in your Instagram stories. So thank you so much. And yeah, thank you for listening to the podcast. So beautiful. Today, I'm going to be talking about the topic of reflux, but I first want to share with you the question and the topic that came from Glenda. She's put a question in and then she put a comment in as well. So I want to share both of those things, and then we're going to talk about reflux, dietary and lifestyle changes, management, all of those topics. First, thank you so much, Glenda, for submitting this. Your question was, severe acid reflux after ASK surgery, doctor recommends revision to duo switch, which is duodenal switch. So this is a big question. First, Glenda, so sorry you're having such significant reflux. Anyone that's had reflux knows it is not fun. You don't have to have had bariatric surgery to have reflux, but it definitely can come up post-bariatric surgery. Glenda's had a ZIPS procedure, and that's where the surgeon's done a sleeve gastrectomy, but then also bypassed roughly half of Glenda's small bowel. Okay, she's recommending the doctor there is a revision to a duodenal switch, which is more of a significant bypass. So that means there's more of the small bowel being bypassed, and there's a bit of changing the kind of the overall plumbing of the bowel, so to speak. Glenda's also submitted the comment, and this is really, I think, a really important thing to put before we even get in to what exactly is reflux and all the other things we're going to talk about. Thank you so much. I have modified my diet, no coffee, no wine, no alcohol, no chocolate, no tomato-based or heavy seasonings. It is bad. Had EGD done. And that is, just for people, if you don't know what that is, That is where they put a scope down with a camera from the mouth right down through the tummy into the duodenum, the first part of the small bowel. They have a look around and see what's happening. Lots of bowel, please advise. A second surgery was not in the plan, but I can barely speak above a whisper. Coughing is bad and constantly clearing my throat. Feeling defeated emotionally, physically, socially, and now financially. So first, let's talk about what exactly is reflux. And most people will have heard the term either reflux or heartburn. And what we're really talking about is when some of the stomach contents come up out of the tummy and they start going up your esophagus. I'm a visual person, so I've got a picture in my head and I'm going to do the best I can to describe and just make sure we're all on the same page with anatomy. Food goes into the mouth, we chew, there's saliva, and that's really when the digestion process starts. We swallow, it goes down the esophagus, one of our pipes, down into the stomach. Between the esophagus and the stomach is a sphincter, esophageal sphincter. And it's really important because when it's working well, it stops food contents leaving the tummy and going back up. And it can go back up a little bit or it can go back quite a lot. And when somebody like Glenda is talking about coughing, or people say it comes into their mouth, that means the stomach come up really high. Into the mouth, obviously really high. Glenda's coughing because some of the stomach contents are coming up and her coughing is to clear her airway. So the fluid doesn't go down into her lungs, it's to get it in the lungs and keep it in the esophagus. Reflux gets brought up and talked about and does happen for some people after having a sleeve gastrectomy, a vertical sleeve gastrectomy, which Glenda's had. And that's when the stomach has had a good portion of it removed, but the sphincter is still there, esophageal sphincter. At the bottom, between the stomach and the first part of the small intestine, which is the duodenum, that sphincter, the pyloric sphincter, is still there as well. And so, as you can imagine, if we overfill the tummy, or if we have foods that are irritating and we've got a very small stomach, and your pyloric sphincter's there going, no, you're not getting past me. The only direction your stomach contents can go is up. And we produce acid in our tummy to help further that digestive process. So the contents of your stomach are acidic and can be very aggravating to the lining of your esophagus. People experience a burning feeling in their lower chest, up higher chest. The pain can radiate out and can go across the chest, can feel like there's something stuck in their esophagus. And if it comes right up, as Glenda is experiencing, that need to cough to clear the airways. And so it is a very significant issue for people to manage. And I'm going to talk to you about what we do from a dietetic point of view. And then we'll also talk about the other medical interventions that can be looked at to help manage reflux. So let's look at some of the things from a dietary intake and also lifestyle changes that can help you manage reflux. And this is something I work on really commonly with clients. And I'm going to I'm first going to say, Glenda, good on you. You've made some wonderful changes. And I'm just going to work through what Glenda said, and then I'm going to add a few things, okay? She's modified her diet, so wonderful. No coffee. Caffeine can be irritating to the stomach and can exacerbate reflux. No wine, no alcohol. Alcohol can also exacerbate reflux. Chocolate, yes, chocolate can exacerbate. Tomato-based or heavy seasonings, so spicy foods, we want to avoid tomato-based and acidic foods and fluids. Tomatoes, lime, orange juice, oranges, so acidic things. So let's just recap of some of the foods and fluids that can exacerbate and increase your reflux. So that's the coffee, highly caffeinated, even carbonated beverages, alcohol, chocolate, the acidic foods and fluids So, yep, tomato-based, and I know I'm repeating myself, but I just want to make sure this is all kind of laid out really clearly. And anything like lemon juice, lime, lemon cordials, anything like that. And the spicy foods. So it can be the curries and the highly spicy, flavoursome foods. So it's around listening to your body and really seeing and listing down when you notice a food or a fluid exacerbating your symptoms. So that's one part of what we can work on and look at to help you manage reflux. Another part is the how we eat, and I'll talk about that, and then I'm going to talk about posture, but how we eat. And if you listen to my other podcast, what I talk about a lot, and I talk a lot about how we eat after bariatric surgery, and this does support, even if you are struggling with reflux, it's about small bites, chewing well, eating slowly, and that allows time to identify when you're satisfied and not overfill your stomach. Overeating is going to exacerbate your reflux because your stomach has only got so much capacity. If you overfill, it goes up because you've got your esophageal sphincter not working as tightly, okay? So the small bites, chew well, eat slowly, and stop when you're satisfied is really important, not overeating. And we want to also bring in the habit of, and you'll think, oh, Jane's on that again, regular meals, because when we eat regularly, we're more likely to be able to tackle the next meal slowly. When we have big gaps between our meals or our snacks or whatever you want to call them, you're going to get to that next meal and you're going to be so hungry it's really hard to eat slowly. And then you eat quickly, you're more likely to overeat, and that can exacerbate the reflux. Okay, so we've touched on the foods and fluids that can exacerbate. And it sounds simple, small bites, chew well, slowly, stop when you're satisfied, but actually there's skill, there are reminders that we need, there are things we need to practice, and it's much harder to do it and build it as a regular habit. There's a lot of benefits to doing that work, okay? And then the third part that I wanted to talk about is posture. So we want 2 to 3 hours to happen after eating before we lay down flat, lay on the couch, lay in bed. We need to allow that time for the stomach to process and release your stomach contents out of the stomach into the intestine, okay? And then that limits or lowers what you've got in your tummy. So eating, and this is particularly going to be for in the evening, we want to finish eating 2 to 3 hours before we go to bed. We want to make sure we've got that time before we go to bed. If you need to rest, we want to be propped up. We want to maybe sit in bed with cushions behind us and kind of semi-sitting up, because we're talking about just the basics of gravity. And if you lay down, it's gravity, it's easier for that stomach contents to leave your stomach and come back up your esophagus. Now feels like a good time to take a short break, as I want to share with you a bit more about my coaching and support services, who they're for, and how I help my clients get the best out of their bariatric surgery.
Now tell me, is this you? You have had your bariatric surgery and you're feeling lost, you're lacking support, and you don't know what to eat and when. Or you may have noticed after your surgery, your hunger and cravings have started to return and you are scared you won't reach your goals. You may have had some weight regain and you want to stop the weight regain and lose some more weight. You may be pre-surgery and you want support to be fully prepared for your weight loss surgery journey. If any of these sound like you, then listen up. I have developed my Bariatric Nutrition Bootcamp just for you. My coaching program provides education, coaching and community for people getting ready for their weight loss surgery and at every stage after their surgery.
You were so fantastic. You didn't just go, here you go, off you go. You were like, right, here you go. Let's do it step by step. And it's that step by step. If somebody's prepared to help you like that, it's immeasurable. It's priceless.
Your help just changed the game for me, right? It just changed the trajectory of my ability to understand what my body's telling me and trusting it. That was a hard one, right? Because my body, I can override it in a lot of ways in the past.
I think that hiring Jane has actually been the best thing that I've done. I was lost. I had no idea what to expect. I've never done bariatric surgery before. I've never had it done before. So yes, you have all the information from your surgeon and from their nutritionist and all that sort of stuff. If you have lifetime support, that's great. But a lot of times you don't. So you need to take that next step and invest in yourself, because that's what it is. It's the most amazing investment that I've made.
There are 4 key areas that I focus on with my clients in my Bariatric Nutrition Bootcamp. One is the Bariatric Nutrition Basics. You will learn what and how to eat so you feel satisfied, reach your protein and fluid goals, and have less cravings, and know how to manage your hunger in the future. Meal ideas and meal planning. You'll learn to plan meals and snacks that you like, so you have great options on hand when it comes time to eat. Also, we focus on mastering weight regain habits, identifying any habits that are stopping you from reaching your goals, and create manageable strategies to get back on the straight and narrow so you can manage your weight for the rest of your life. And also, I focus with my clients in my Bariatric Nutrition Bootcamp on learning to trust your body and food. Start to enjoy your food again by relearning to listen to your body cues so you have less guilt and improve your relationship with food and your body. If you are ready to maximize your weight loss surgery results, feel confident in your journey, and be led with support and expert guidance, then the Bariatric Nutrition Bootcamp is for you. If you would like to know more about my coaching program, check out the link in the show notes.
So they are the things that we can do from a dietary choice, lifestyle, behaviours, okay? And they can be really impactful for managing many people's reflux. So that's one area that we can focus on. Another key area that is very important and very helpful is medication. And that can be kind of for longer periods of times, or it can just be when you need it. And that's very much a conversation to have with either your bariatric centre or your general practitioner, your GP, your primary care provider. And they can prescribe medications such as the proton pump inhibitors, such as pantoprazole, omeprazole, and those type of medications that will lower stomach acid production and help relieve that kind of burning sensation and those side of the symptoms. If you are on long-term proton pump inhibitors, we really want to watch your B12 levels. That's part of what working with a bariatric dietitian, they will keep an extra close eye on your B12 levels. But most doctors don't want you to be staying on the proton pump inhibitors or those medications for a long time. Can you get some things over the counter to help with some symptoms? Yes, you can, but they're not going to be as kind of long-lasting or as impactful as seeing your doctor about a medication. So often the dietary, for people's reflux management, dietary as well as the medication is really where we start. If things can't be managed, that's where, like Glenda is having discussions with her surgeon. And I'm guessing it's a surgeon that did that revision, because she wouldn't be having that conversation with her general practitioner or primary care provider. Now, Glenda, I am very sorry, but I cannot share any thoughts on whether or not you need a revision, and I'm going to explain why. That decision of all the things that you've done and all the management, that's very, very much needs to be overseen by your doctor, and that decision whether to have a revision lands very much between yourself and your surgeon. So it's very much of a surgical patient discussion, okay? As a bariatric dietitian, have I had many clients that have had revisions over the years? Yes. More commonly, it's from a sleeve gastrectomy to a Roux-en-Y gastric bypass, and that can be very successful for people to manage and remove the reflux. We don't want reflux to go on and on unmanaged, because the stomach contents, because they're acidic, they can be very aggravating to your esophageal lining, and there are issues that can come out if it's going on for a long time. Plus, it's super, super uncomfortable, and it's just very disconcerting, and it can be really impactful on your quality of life. So you've done really well, Glenda. I know it's really hard to hear that, in the sense that you've made some great dietary changes. You've been seeing your doctor, and I really encourage people, when they are challenged by things, don't suffer in silence. Go back to the bariatric centre, if not, go to your primary care provider and say, this is not working, I need help. And they've done for Glenda some exploration, which is gathering information, what's going on. And then they say, well, you're doing this and that hasn't helped. I'm guessing you've been on proton pump inhibitors or something like that, hasn't helped. The next step is, this is the next option we have for you, a revision. And yes, it's that going through it physically again, emotionally, socially, and now financially. And if it wasn't planned, and it's really tough, okay? So I hope you continue to get great support from your primary care provider as well as your surgeon, and that decision to have a revision surgery lands very much between you and your surgeon. So I know I haven't been of great help at all, but I did really appreciate your question and what you shared, because it certainly does happen for some people, and it's really, really challenging. If you wanted to get back in and share how you're going, Glenda, I would love to hear how you're going. So thank you so much for joining me on this podcast and getting to this point. I want to say thank you so much for your support. I hope you found it of value. And if you think somebody would also find it valuable, please feel free to share it. I don't advertise my podcast. It's really word of mouth that it's spreading, how it grows. So thank you so much for your support, and I look forward to having you with me in my next podcast. Bye for now.